Hi, and welcome back to Healthcare Simplified with Manvir Victor right here on Vital Signs Asia. We'd love for you to be a part of these discussions that we have very regularly about healthcare and how it affects you and how you can have your rights more in line with your healthcare as well, personalized healthcare. A lot of that obviously is available here on this YouTube page. So what you need to do is just subscribe to it and get along to a lot of the information that we share. We've got shorts, we've got long periods like what we're doing right now. In the studios right here with me today, I'm very pleased to have the Director of the Digital Health Division of the Ministry of Health in Malaysia, Dr. Mahesh Appannan. How are you, Doc?
Hi, very fine, thank you.
Thank you for being on the show. And, you're the Director of the Digital Health Division, right? And you're a doctor. So please tell us about the journey from a doctor to moving towards this. Because a lot of people don't understand that doctors obviously love digital health. You're one of those people that in the past, 3-4 years that I've known you, I've noticed that you really love it as well, from being a doctor. So tell us a little bit about that journey for you from digital health, from public health to digital health. Tell us about that.
So thanks, Maria, and thanks for having me here today.
Yeah.
And it's indeed an honor to be here to share a little bit of what I know. Yes, I'm a doctor and I'm a public health doctor. Previously, I worked at the Disease Control Division.
Okay.
And I have got many years of clinical service, really working on the ground,
Right.
looking at how people are in the sick care arena, now the healthcare arena. Right. And it all started during COVID-19, where I was in the Crisis Preparedness Response Center, trying to see how best we do surveillance in public health.
Absolutely.
And I do a lot of data analytics. And if you want to, play with data analytics, you need good digital health tools.
Absolutely.
So that's when I got involved in the Digital Public Health Division within Ministry of Health, a very new division then, about 2 years back. And then we really saw the benefit of having Digital Health Division, where we innovate, we create, we see how best technology can augment healthcare.
Okay.
So in March 2024, Ministry of Health, the high-level management, my minister especially, thought that let's not work in silo anymore. Let's have all digital health units combined into one.
Okay.
And that's where in March 2024, the Digital Health Division was formed, and I was given the task to lead this division.
So you're the first director of this division.
Correct.
Absolutely. You are fantastic. We met during COVID, because we were looking for data and all this. So very interestingly, recently I met with the current Minister of Health, Datuk Seri Zulkifli, and he was talking to me about moving the Ministry of Health from sick care to healthcare. That's a huge pivot, right? Very important is obviously knowing what are the sicknesses, what do people need, where do they need this, and then you look at healthcare, which is the preventative part of it, so that you've got a large population here in Malaysia, 34 million, and obviously already the hospitals are close to maximum, if not already past it, right? So we're looking at how do we manage that. And part of that management is looking at the people who are well and healthy and trying to ensure that they stay in that healthy position as long as they can. Now, that's the health care part of it, right? So how do we see digital healthcare moving to assist this?
Excellent question. Very good preamble. If you look at this part of how digital health would help out or assist preventive healthcare, it is basically going to be or is the backbone of preventive care.
Okay.
Number one, when you talk about digital health, you talk about data.
Yes.
How do we now primordially prevent someone from getting ill?
Okay.
Primarily preventing them from getting ill, right? So when you talk about preventive healthcare, as in the public health fraternity, we talk about the various different levels of prevention.
Sure.
The often known one is primary
Right.
prevention, but now we are moving towards primordial prevention.
Okay.
Identifying risk factors in much more advanced.
Okay.
Right? Identifying all those important individuals who are at risk of potentially being sick in
Sure.
the next few years.
Absolutely.
How do we now institute analytics like predictive,
Right.
then eventually prescriptive analytics? So it's basically looking at health information data, various different other data sets, combining everything together and identifying this, and eventually reaching to what we all want, precision public health.
Okay.
Right? How will the government, how will Ministry of Health identify and precisely intervene on certain cohorts of the population who really needs intervention to prevent them from getting sick eventually. Right? So, like what I said, digital health as the backbone, using various different data sets to identify this particular population.
Okay.
And once we have identified, we can use digital tools to intervene.
Right.
Like for example, I would like to give you this example of, knowing Mahesh, probably now overweight,
Right.
having various different family history of diabetes.
I didn't say that. You said
Right?
Okay.
Having history of diabetes, family history of diabetes and whatnot. So Mahesh is sort of like categorized into the possible individual with risk factors.
Okay.
So now how our public health experts can tailor care plans to intervene, to institute any sort of preventive mechanisms to nudge him to, make sure that he doesn't move into the next bucket, which is being pre-diseased and eventually diseased.
I see. So just keeping you as healthy as possible and digital tools.
Yes, using digital tools. I think that's very important.
Okay. So there's this ambiguity about digitization versus digitalization. Now, a lot of people, I've been in digital media for many years, and they think it's both the same thing. Explain it to the people who are listening in the simplest terms. Digitization versus digitalization. What's the difference here?
A huge difference.
Okay.
Right. And sometimes when people talk about, my hospital, my clinic is already digitized.
Yes.
So in simple terms, digitization is basically a glorified paper.
Okay.
Having all those, whatever that you write in the paper, you just type it in the computer.
Okay.
So basically how you put in data, how you put in information.
Sure.
Right? That is just basically digitizing something.
All right.
From paper format to electronic format.
Okay.
When you say digitalization, that's where the power of digital transformation comes in.
Okay.
How do you actually automate certain processes?
Okay.
How do you simplify certain processes?
Okay.
In normal days, you take 3 different individuals to do a task.
Right.
Now you put in various different algorithms in place.
Yes.
How do you automate all those processes?
Okay.
So you reduce the number of people, increase productivity.
Right.
Increase patient journey, better outcome of patients who visits any facility.
Right.
So in other words, when I say a facility has been digitalized, that means after introducing some sort of digital health tool, patient waiting times reduced.
Okay.
Right. Patient outcome is better. Experience becomes better.
Okay.
I used to take 3 hours to see a doctor. Now I see a doctor within 2 hours. I see a doctor within an hour. These are the things that will and should happen and would happen if you digitalize a facility.
Right. So which means that a patient walking into the hospital for treatment or whatever to see the doctor, that entire process just quickens. So obviously the service is quicker to the person because there are a lot of administrative stuff. It's a lot of administrative stuff. And it's the same thing, you go in there, you register your name, your IC number, whatever. And that process. So if it's digitalized, it just speeds it up.
Yes.
And then doctor is able to see the patient, get his entire history right in front of him and say, you are on this medication. Okay, I'm going to take you off that. We're going to change it to something else that gives you a better effect. And that can be done immediately, right?
Precisely. So basically identifying all those redundancies in manual processes,
Okay.
redundancies in probably electronic processes.
Right.
How do you introduce a much more innovative way to reduce all those,
Okay.
remove all those redundancies?
All right.
That's basically what digitalization is all about.
Okay.
In layman words.
Okay, so now Malaysia prior to COVID, 2020, 2021, had none of these. I'm saying this, right? I don't know whether it's true, but I'm saying they had really none of these. But fast tracking COVID was very effective because we had our My Sejahtera. It was an app. Now, is that digitalization of some sort?
Definitely.
Okay.
So just to clarify one
Right.
thing, prior to COVID,
Right.
we didn't have EMRs.
You-
We did have
electronic medical records. Okay.
We did have not quite a number of facilities. In a nutshell, about less than about 13% of our facilities digital.
So out of 13%, so the ministry has got
We have got 150 hospitals.
150 hospitals
We've
and
got
about 1,100,
1,118 primary healthcare clinics.
which is the clinic is here.
Yeah, and about 2,000 over rural health clinics.
Okay.
700 dental clinics.
Okay.
So out of that,
Okay.
less than 13%.
Less than 13%.
Who had some sort of digitization or to a little bit of an extra digitalization
Okay.
already there.
Okay.
But of course, that wasn't enough.
Right,
It wasn't
obviously,
enough,
yeah,
definitely,
yeah,
right?
yeah.
So COVID-19 definitely spurred. It was the catalyst.
Yes.
It actually was the only factor which brought digital health into prominence,
Yes, absolutely.
besides public health.
Yes.
How, when you mentioned My Sejahtera, of course, that was actually a public health marvel
Right.
at that point of time.
Yes.
How we used that single app
Yeah.
to manage and augment the entire pandemic management.
Absolutely.
And if you look at literature, data.ai
Yeah.
has ranked Malaysia as one of the best country
Yeah.
to manage the pandemic
Yes.
with the aid of some sort of a digital tool.
Right.
A few things that we very, very quickly I can say and
Sure.
MOH is really proud of
Right.
is how we managed COVID-19 patients, especially Cat 1, if you remember,
Yes,
all
yeah,
those
category one.
mild COVID-19 infection, how they were managed at home.
Right.
Can you imagine? They could report themselves of being positive.
Right.
They could monitor themselves on a daily basis.
Yeah.
If they had any deterioration of any sort,
Yeah.
as someone who will come to your aid,
Right.
and eventually also get a home surveillance order at that point of time. You remember,
Yeah. Yes.
and eventually discharge yourself
Yes.
end to end. And a fantastic story I would like to share with you
Sure.
was during COVID-19 at the height of it.
Right.
The biggest COVID assessment center
Right.
was Stadium Malawati.
Yes. In
Right,
Salam,
they were
yes.
seeing close to about 6,000 patients a day.
Wow. Okay.
And all our dear friends, all our healthcare workers were all suited up like astronauts,
Yes.
without air-cons, just burnt out looking
Yeah.
at patients.
Yeah.
And that was the turning point. We had digital drivers, we had digital enablers at that point of time.
right.
All our high-level management looked at real-world data.
Right.
They thought, never mind, all these stable patients can be monitored at home.
Right.
After having this end-to-end digitalization,
Right.
we reduced the number of patients from 6,000
Right.
to less than 1,000 in just 2 weeks.
In 2 weeks.
In just 2 weeks.
Wow.
Right? And this showed the power of having a digital tool,
Right.
having real good decisions at that point of time,
Right.
and executing it. I think that was important.
Yeah.
And not only that, during our vaccination program,
Yes.
we managed to vaccinate more than 90% of our population
Yeah.
4 months before target.
Right.
How? Using the database that we had,
Yeah.
identifying the specific population that we had to vaccinate first,
Yeah.
and tada, we
Yes.
got all of them vaccinated
Yes.
in less than 4 months
Absolutely.
from our target date.
And I think a lot of people don't understand the importance of us being able to do this. Malaysia is a developing country. When COVID started, I was living in the UK. And it was the shambles. It was an absolute shambles there. They tried to do an app and I think it's the Isle of Man or Isle of Wight or
Okay.
something like that, and it crashed. It crashed on that island, and I think there are 2,500 people there or something like that. But we deployed it here successfully, and I remember being in media and when the minister then YBKJ, he released all that information on a daily basis on the site, and you could see the red zones, the hot zones, the yellow zones. You could see all that. So people really knew what was happening around them, and they could take the precautions necessary,
yes.
obviously.
Yes, extremely important. Extremely important. We started co-creating at that point of time, empowering the community. Your health information should be with you.
Yes.
Your health information should be at your fingertips, and that happened during COVID.
So that is basically sparked where the digital health division is going with this, right? Okay, we're going to come back with more. We're going to take a quick break. Hold your thoughts. I've got some more to ask you because, you've just given us a lot of things to think about. We're coming back with more right after this break right here on Healthcare Simplified with Manvir Victor. See you soon. Hi, and welcome back to Healthcare Simplified with Manvir Victor. We're back here talking to Dr. Mahesh Appannan, the Director of the Digital Health Division of the Ministry of Health, Malaysia. And do hit that subscribe button to keep us in the loop and let us keep you in the loop of what's happening with healthcare right here. And so, Dr. Mahesh, my next question to you, this division started in 2024. That's about a year ago.
About a year.
Now, what have you all rolled out or developed already? I mean, you've got tremendous amount of learning from COVID. What have you all done so far with the 150 plus hospitals? You've got 1,000 plus clinic kesehatan. Where has it been deployed? Where can people see this and use these tools already?
Right. 1 year seemed like many years, right?
Okay.
And you can see I've lost even more hair after COVID-19. But this 1 year was really significant. Many
Okay.
people might not have seen our direct output and throughput,
Sure.
but there were lots of groundwork
Okay.
that was done. Right?
Sure.
The first thing that we did was we came up with the entire digital health framework. How
Okay.
do we want to actually navigate and future-proof
Okay.
and also future-ready our digital health ecosystem?
Sure.
So, because our ultimate aim and objective was to ensure patient centricity
Okay.
and made sure digital health ecosystem is sustainable.
All right.
If you notice, the Honorable Minister, Health
Yes.
Minister, always says one citizen, one record.
Okay. Yeah. Okay.
Satu rakyat, satu record.
Right.
Eventually, that is the dream of every single medical practitioner.
Okay.
How do I ensure for continuity of care,
Right.
I know the patient's health status,
Okay.
right? So we've got all that frameworks
Right.
there. It's supported by 6 different pillars, 3 fundamental foundation,
Sure.
right? Which also includes a scalable, resilient digital infrastructure in all our
Sure.
clinics.
Yes.
Having managed all our data properly, cybersecurity comes into play,
Absolutely.
and also not forgetting how we increase digital literacy amongst the community at large,
Yes.
and also our healthcare workers.
Of course.
And we came up with 3 most important interventions. The first
Okay.
thing is
Right.
ensuring that all our healthcare facilities were going to be digital ready,
Okay.
right? Infrastructure, connectivity,
Yes.
and whatnot. While doing that, we also want to make sure that all our healthcare facilities would be fitted with electronic medical records.
Okay.
Basic, fundamental.
Yeah.
And concurrently also, not letting whatever investment that has been made throughout these 20 years,
Yes.
all our digital infrastructure,
Yeah.
digital health infrastructure.
Right.
How do we make sure we also leverage on them?
Okay.
We cannot let it go to waste, right? All
Absolutely.
the
Yeah,
investment that
Sure.
the government has put in. How do we now use that, engineer all those databases,
Right.
and get all those information back to the patients?
Right.
So very quickly, in this past 1 year, we've managed to transform My Sejahtera from a COVID-19 app
Okay.
to a public health app, the
Okay.
National Public Health
Right.
app, right? That's one digital infrastructure that we are leveraging on.
Okay.
Why? Because we already have that app. Almost all people living in Malaysia has got that app. Why
Yes.
waste it, right?
I think about 20 plus million people.
Yes, close to about 30 million
30 million
users.
people have
and at the current moment,
Right.
close to about 10 million active users.
Okay.
Right? It's one of the biggest digital health asset that Ministry of Health and the government has right now.
Okay.
So we need to leverage on that.
Okay.
Besides that, all those existing digital health platforms,
Right.
How we engineered it, how we re-looked at it, how we made it, eventually to be scalable enough.
Okay.
Integrating it and,
Yeah.
and whatnot. So that is one very important thing. Right now, if any one of you who's got My Sejahterra
Go
can
ahead,
just
yeah.
open up that particular app.
yeah.
First of all, update the app.
Right.
Many of you might have not updated the app.
Yeah.
Open up, you can actually see all your medication summary
Yes.
in there. And that's super important. As the doctor myself.
Right.
Yeah, you want to say?
Tell me how, because you taught me how to do this, but let's teach the people who are listening in right now how to do that on your My Sejahterra.
Very, very simple. First, go to the App Store.
Yes, yeah.
Update your application to the latest version. Another latest one is going to come out very, very soon.
Okay.
That I would not want to talk about it now.
Yeah.
Let that be a surprise to all of you.
Okay.
Very quickly, go down to your health records component, an icon just below
Yeah.
My Sejahterra. Click that, and you have all your different variables, medications, various different aspects of health
Right.
information there.
Right.
Just click on medication summary.
Right.
And if you have visited any of our government healthcare facility,
Sure.
which uses the pharmacy information system,
Right.
you have that information there.
So it's there, so you can actually show it to other doctors.
Correct.
In
You
case
know,
they ask you,
yeah, I mean,
what do you
this
need?
has always been the biggest need of doctors because, whenever a diabetic patient or a hypertensive patient or a dyslipidemic patient comes to see us in the clinic, we'll spend almost 5 minutes asking them, what is the medication that you're taking?
The blue one.
The
The
blue one.
white
The rounded one.
Yes.
Which I always take it at night sometimes,
Yeah.
So we will have that guessing game of,
Yeah, yeah.
okay, this is amlodipine 5
Yeah.
milligrams
Yeah.
that's been prescribed for the patient. So now you have all that at your fingertips.
Right.
And this would save significant time for doctors to elicit history. And we can be more precise in
Yes.
whatever medications that we would want to
Yeah.
eventually prescribe to you. So that's about how we have pushed all those
Okay.
information to the patients.
Right.
And more is coming.
Okay.
Right? More is coming.
So how many hospitals are already got this system? Do you,
Close to about 900 over facilities in
Have this
Malaysia.
already?
Yeah,
Public
almost
health. Yeah.
public health.
Yeah.
Almost all primary healthcare facility has got PHIS. So if you visited any of those,
Okay.
your prescription summary would be at your fingertips already. Some of the hospitals basically are not using that. We are enhancing all those
Sure.
hospitals,
Right.
and credit should go to my fantabulous pharmacy program
Okay.
in the Ministry of Health
Right.
for having this superb database in
Yes.
place, which we could easily connect to it.
Right.
Second,
Yeah.
not only that, we have got all your dental records. Today, if you
Okay.
visit any of our dental, government dental
The 700
facility,
plus.
about 700 plus,
Yeah.
your summary of whatever that was treated would be also in your My Sejahterra. So more would be coming in.
I see.
So that is one thing very exciting.
Right.
My esteemed team members, my colleagues within the digital health division,
Right.
has been working on together with our partners. The
Yes.
tech players.
Yeah.
A huge thanks to all of them because it's not easy.
Right.
The second important thing that
Right.
we did was to quickly digitalize some of our primary healthcare facilities.
Okay.
We came up with a very interesting model
Right.
on deploying cloud-based clinic management systems
Okay.
at scale, speed,
Right.
low cost, eventually providing the highest impact.
Okay.
Like what our fellow colleagues in the private practice,
Okay.
the private general practitioners. Today, you go walk into any of our friends, private clinics.
Right.
There's no more. Probably most of them don't use paper, pen anymore.
Okay.
It's all computerized.
Okay.
Just taking that model,
Right.
we replicated it to our
Clinic Kesihatan.
clinic Kesihatan,
primary health.
and you'll be surprised. We managed to deploy that system to 50 different clinics in 6 weeks.
Wow.
Yeah.
That's admirable. Yeah.
Yeah, and we're going to do that for 100 clinics this year. We're targeting to digitalize close to about 300 different primary healthcare clinics this year. And the results
Okay.
is amazing.
Okay.
Results amazing.
So that's number 2. What's number 3?
Lots more coming up.
Right.
I'm trying to now look into the hospitals.
Okay.
How we want digitalizing hospitals a little bit more difficult.
Of course. Bigger.
It gets the cost is even more.
Right.
But we are looking at various different ways,
Right.
various different models to ensure very quick deployment as well.
Sure.
So more interesting news coming up.
Okay.
We'll be making sure that we have this
Right.
Also in the same trajectory as how
Right.
we are doing it for our dental clinics and primary health clinics.
So when you look at it and you say you're working on hospitals, you've got some hospitals already which are digitalized, primary care clinics, dental clinics. How does this entire ecosystem now help people have better healthcare? And the investment made, obviously, investment made is to help people, help the citizens, right, have better health, but at the same time prevent illness. So how does this do that, and over a longer term save the country money and lives, and pain and suffering?
Yeah. So the first thing is
Yeah.
we want to co-create.
Okay.
We want to co-create in the meaning of getting all those patients are ours,
Right.
healthy individuals are ours,
Right.
to take charge of their health.
Okay.
So how do we now, after every encounter
Right.
in your clinic, hospital, dental clinic,
Right.
all those encounter summary to be pushed to you. So you'll be aware.
Okay.
On this date, I went and saw, I went to see a doctor so-and-so at clinic so-and-so,
Right.
and this is my diagnosis, these are my allergy history, these are my medications prescribed at that point of time.
Okay.
And how do we now empower all those individuals to share their health information to the next facility that they go into?
Okay.
So now we are moving away into, centralizing all those information
Sure.
to pushing all those information to the patients,
Right.
and empowering them now
Right.
to collate all this health information,
Right.
and with their consent, they themselves sharing their health information to
Okay.
a different facility. And we tested this out.
Okay.
And Malaysia proudly is one of the first few countries to introduce this, following the World Health Organization Smart Health Guidelines.
Okay.
Getting into this thing called the International Patient Summary. And we tested this for the Hajj pilgrims.
Yes. Okay. Yeah.
First of all, we digitalized the entire Hajj screening program
Right.
in 2023.
Okay.
And today now, none of our Hajj pilgrim holds any Hajj book.
Okay.
They are all digital. They have got all their health screening information
In an app.
in their app.
And so when they go for their Hajj, if something happens, it's picked up.
Correct. You can share this to any of the healthcare facilities at the Holy Land of Mecca.
Right.
Right. So all these makcis and pakcis who are more than 60 years old,
Yeah.
how Tabung Haji and Ministry of Health ensured that they were digitally literate.
Yes.
Now having the power of their themselves having
Yes.
their information at their
Right.
fingertips and sharing this. So we were one of the first few countries to implement this.
Wow.
And now many of other countries who are already following suit.
Right.
But this gave us an idea on moving towards a very sophisticated way of health information exchange to just having patients
Right.
or patient-led
Right.
health information exchange.
Okay. Wait, tell me a little bit more about this patient-led health information.
So now we have already gotten health information being pushed to patients.
Right.
That's the first
Okay.
thing that we did.
Right.
Now, if this particular patient or healthy individual who visits the next healthcare facility,
Right.
he would have the entire liberty to choose whatever health information that he has collated
Okay.
to be shared to the next healthcare facility.
So he can choose what he wants to share.
Correct.
What
Correct.
he or she wants to share.
Correct. I think that's the first step
Okay.
that we
Right.
want to do.
Right.
Having a continuity of care,
Right.
having not making any error in diagnosis and
Yes.
whatnot.
Yeah.
The patient can choose whatever important stuff that they want to share,
Right.
and they can share it with the healthcare facility.
Yeah.
And this, we call it the Malaysian patient summary,
Right.
a replica of
MPS,
international
yeah.
patient summary, IPS to MPS,
Yeah.
where now you'll be surprised with the amount of support that we're getting from private healthcare facilities
Oh.
who has now joined this network in a sandbox, in a trial
Right.
environment.
Right.
Now they can be within this network,
Right.
trust network,
Right.
having the capability of them reading all those information that wants to be shared by the particular patient.
Wow. That's a tremendous leapfrog for Malaysia. I mean, we're doing something positive in that. So, and the reason I've got you here on Healthcare Simplified is, Dr. Mahesh, is because you and I have been talking about this, but, and I've gone out and I'm telling my friends about it, because that's why you're here today, is to explain this so that people look at it and say, wow, all these things are happening and nobody knows about it. And they should, because you have now empowered the patient to share their information. But if they don't know they have it,
They can't, yeah, you're right.
they can't do it, right?
You're right. So I think that's where we are trying to improve ourselves in trying to communicate. And thank you, Manvir, for giving this opportunity for us to start, telling everyone that whatever we have and whatever is coming, so that we can improve together as to have a better healthcare ecosystem.
Yeah, because I think, do you find healthcare staff opposing this or supporting this?
To be very honest with you,
Yeah.
almost all are very, very responsive and
Absolutely.
receptive to this. But of course, you do have these challenges
Sure,
of
of
change.
course. Yes.
You do have these
Change is
challenges of
difficult, yeah.
change because, healthcare workers, I'm guilty as charged.
Yeah.
We are one of the most difficult people to change.
Right.
Because, we are treating humans, we are treating patients. We have to be safe at all points of times.
Yeah.
And we are the lowest risk takers. We don't want to take so much risk, right? We're already comfortable with whatever that we have.
Right.
And when we want to have some change,
Right.
it's a bit difficult. So in our division, we have this change management mantra.
Okay.
Okay, you see,
Right.
you feel,
Right.
then you change. So how do I change someone's mindset?
Right.
By showing them the power of digitalization.
Okay.
How does that actually save time?
Right.
How does digitalization actually improve productivity?
Sure.
How does this change eventually your working mechanism?
Right.
You can now have an assistant with you
Absolutely.
who would eventually let you go back home.
Yeah.
Peace of mind.
Yeah.
How do you introduce later on, a lot of technology like AI and whatnot to augment your work process?
Right.
So when you show them the power,
Right.
that's when they start, wanting to change.
Absolutely.
And I trust that we are making great headwinds.
Right.
We are making great progress.
Yeah.
We have fantastic people working down there
Right.
on the ground.
Yes.
It's our duty to introduce, digital tools to help them in their day-to-day work.
Yeah.
Yeah.
And I guess, I mean, from a patient's point of view, Dr. Mahesh, when we go to see a doctor, sometimes we're not in the right frame of mind because we are not feeling well, you have hypertension, whatever this thing is, because of pain. You're not able to articulate back to the doctor accurately. You may not, maybe dizzy, whatever. So you're not able to explain to the doctor how he's supposed to save your life or make you feel better. So having these digital records is extremely important because I click a button here, you have a look at it. And then they go, oh, okay. Now we know this medication may have caused this or whatever it is, And this is actually what saves lives. And you're looking at scale. When you look at scale, you were talking about scalability. 34 million people. We've got a deluge of NCDs happening, non-communicable diseases, diabetes, hypertension, all these things happening, which are lifestyle diseases, right? So how do we keep it at bay? And having digital health, like you were just saying, helps put in place some pillars inside there so that we are able to manage this a little better, isn't it?
Yeah, definitely. I mean, in the next few years, I mean, we have got some interesting plans in place.
Okay.
I mean, do you wear a smartwatch?
Yes, I do. Yeah.
What do you? Why are you wearing a smartwatch?
I want the data. Yeah.
Yeah, but definitely, like me, we only look at our
Watch the
number
time.
of watch the time, and also look at the number of steps that we have taken.
Right.
But you know what else it collects? Your sleep pattern,
Yes.
your heart rhythm and whatnot. How now, if my primary healthcare team,
Right.
if you consent,
Yes.
could actually analyze those data.
Absolutely. Yeah.
And there you go. You have all this beautiful information
Right.
that can give insights to your treating physician to treat you better.
Yes.
Yeah. So how do we now identify, early warning symptoms
Yes,
for us to make a more accurate diagnosis of your health?
Right.
So these are the things that we want to eventually explore.
Right.
And of course, keeping in mind all those, cybersecurity guardrails in place and learning from countries who have implemented it and to see how best we can move at a greater speed.
Is there one place right now where you can tell people, the public who's watching this, where can they go to find out? Is there a list of hospitals? Is there a list of clinics where, and what are the tools? Is there one place right now that people can get this information?
You can go and look into social medias, Ministry of Health social media pages, and I know you have also published an article, a very point-on article on whatever that we've done.
Right.
You can actually go get all those information from our website, from all those health
health
portals.
tools, everything.
Yeah.
Well, fantastic. Well, thank you so much for coming on this program. Any final thoughts on digital health? I mean, so that, whether doctors are watching it, nurses are watching it, obviously patients are watching it, the people. One thought from you about it.
I think all of us need to understand the fact that we really need to embrace digitalization.
Yes.
Digital transformation is there to stay.
Right.
It's whether you want to be in the bandwagon together or you want to be a laggard. If you ask me, it's about time all of us embrace digitalization. We have to transform.
Right.
Like my favorite quote, by on change.
Okay.
Right.
Right.
It's not the most intelligent people who would succeed, nor the most successful people.
Right.
Not the most hardworking people, but the people who are most responsive to change who would eventually succeed. Beautiful saying by Charles Darwin. We have to embrace change.
Okay.
Right. And when you talk about being left out or being illiterate in this 21st century, is not about you knowing how to write or to read, but knowing how to relearn, unlearn, and continuously learning.
Yeah.
So what I want everyone, my only hope being from the digital health division with my entire team, it's all about, wanting to be digitally, to be digital enablers, to be digital drivers, and eventually having our mindset shifted from an analog mind to a digital mind.
Absolutely. Yeah. Thank you so much for being on the program with us today, Dr. Mahesh Appannan, Director of Digital Health Division of the Ministry of Health. Now, one thing I'd like to add is, as long as you're healthy, you're using we stay in 34 million population, and I think 70 plus million digital devices or something like that in Malaysia, right? Everyone's got two at least. So you are using a smartphone, a smart device. And, whether you're getting Grab or you're ordering your movie tickets or whatever it is, or, you're buying online shopping, you're using it. Use it for your healthcare. Use it for your health so that you are better longer, you know yourself better. And, that's our message for you today. Just hit that subscribe button and subscribe to Healthcare Simplified with Manvir Victor. Once again, thank you so much for being in this program. We'll see you again soon with another great episode right here on Healthcare Simplified with Manvir Victor. Cheers.